Доброго дня, шановні пані.
Good afternoon, ladies and gentlemen. Ukrainian Media Crisis Center continues its work. Thank you for being with us online. The subject matter of our press conference is National Monitoring System on the Situation of Internally Displaced Persons in Ukraine. Let me give the floor to the speakers.
Шановні друзі,
Good afternoon, ladies and gentlemen, dear audience watching us online. On behalf of the IOM, thank you for being with us today. Today we are presenting the report of the two recent rounds of the surveys that was conducted by the National Monitoring System on the Situation of IDPs. We appreciate the Ukrainian Media Crisis Center for hosting this event today, and we appreciate the Ministry of Reintegration and Temporarily Occupied Territories of Ukraine and Ministry of Social Policy for their support in conducting this survey. Let me present the speakers. Today we have Chimenton, Emergency and Stabilization Program Coordinator, the IOM mission in Ukraine, Iryna Kalupakha, head of the Department of Socio-Humanitarian Policy and IDPs, Ministry of for Reintegration of the Temporarily Occupied Territories of Ukraine, and Lunin and Iryna Loktieva, my colleagues, experts of IOM mission in Ukraine, that provide in-depth analysis of the two surveys we conducted. If you have any questions to the speakers, please feel free to raise them either using Viber or WhatsApp. The number is 064979792, or you can leave it as comments on FB of Ukrainian Media Crisis Center or IOM, depending on where you are watching us. Thank you very much, and let me give the floor to Marco Chimenton.
Ms. Kalupakha, ladies and gentlemen from the press, distinguished colleagues, and extended audience, I'd like to thank you for following us today and wish you a good afternoon. It's a real pleasure to be here today together with the representatives of the ministry to present the 16th and the 17th round of the National Monitoring System on the Situation of Internally Displaced Persons. I would like to express, first of all, our gratitude for the U.S. Department of State's Bureau of Population, Refugees, and Migration, who continues to generously support these efforts to provide regular overviews of the socioeconomic situation of the displaced communities in Ukraine. The NMS is one of the key elements of our good and fruitful collaboration with the ministries. And at the same time, it's an essential part of IOM's work because it supports basically all the various activities that pertain to its broad portfolio and that encompass the humanitarian, the development, and the peace dimensions. These surveys are really very important to understand what the situation of among the most vulnerable citizens in Ukraine are. And also to provide an evidence base for programs, not only IOM's program, but for the broader communities program to support these displaced communities and make sure that these programs can have a greater impact. So for this specific occasion, it was decided to combine the results of two rounds, and this was partially because of logistics reason, but at the same time, it's also because this, we thought, could have allowed us to have a more comprehensive understanding of the impact of the COVID-19 pandemic on the well-being of the IDPs, their families, and their communities. So we could also understand a bit better how these circumstances would have influenced their choices and their intentions. Now, it seems though, looking at the preliminary, looking at the data from the report, it seems that it's a bit too early still to assess the actual magnitude of the impact of COVID. And we think this is for two reasons. First of all, well, COVID-19 pandemic is still ongoing, and despite all the countermeasures that have already been taken and are being taken in terms of public health, in support to the economy, in social services, this will continue to have an impact for the months to come, especially on those segments of populations that are the most vulnerable. Second, it's because this reduced time frame does not allow us to have a comprehensive view of the impact and only shows us some hidden changes that are happening within the displaced communities. Therefore, it will be extremely important to see what the results of the next rounds will look like. In general, though, we can identify two important aspects. On one side, we see that the COVID-19 contributes to deepening the divides that are already typical of societies. So this is also reflected in the displaced community. From the NMS results, we can see that the impact of the pandemic is actually different between rural and urban areas, is affecting differently men and women, is affecting differently the older and the younger generations and the different areas of the country. So these differences inevitably will be reflected in the way the IDPs perceive their level of integration across the country, and also they will influence their choices on what to do next, especially their intentions or whether to remain in the communities where they are, to change community or return to their community of origin. Now, on the other hand, there is another aspect, which is how this COVID-19 pandemic is contributing to an overall sense of uncertainty for IDPs' futures and for those of their families and their communities. And this is a very important aspect to take into consideration. If we look, for example, only at the employment rates, we see that they do not seem to have varied substantially. But then if we look at the income, at the average income, we see that this has continued to, per capita, has continued to decrease because of this. So, and also we see that almost a quarter of the IDPs say that they've been placed on unpaid or partially paid leave during the last period. So now this is what I was mentioning before as the hidden changes. Despite the level of employment has not changed, we know that a fourth of them actually have not been receiving their regular salary for quite some time. And this leads to them using up their savings, and this changes the perspective that they have for the future. So in general, it seems that from these preliminary results, the pandemic disproportionately affects the most vulnerable among these categories because they're less resilient and they're less ready to address sudden systemic shocks. As we will see during the presentation that will follow, women and female-headed households in particular are affected more than other categories. Now, to finish, there is a third aspect that is important to highlight. So you've heard mentioning a lot what the intentions are. So we've seen that after such a prolonged displacement, a growing number of IDP families decides to stay in their place of displacement and prefer not to return or change it. So this raises a very important aspect, and this is the aspect of durable solutions. The COVID pandemic can increase can affect this intention to remain where they are, and therefore it is more and more important for the government and for the international and national organization to start thinking about the longer and maybe even generational impacts that this COVID pandemic is having, and starting to think of what durable solution can be provided to displaced communities. Thank you.
Дякуємо, Марко.
Thank you, Marco. Iryna Kalupakha, Ministry for Reintegration of the Temporarily Occupied Territories of Ukraine. Good afternoon, dear colleagues. Thank you very much for the opportunity to speak. I would like to start my comments with gratitude to IOM, the Bureau of Population, Refugees and Immigration of the U.S. Department of State, for their regular surveys and reports of the NMS on the situation of the IDPs in Ukraine. These quarterly reports give us additional tools to assess the situation with IDPs in Ukraine, to identify the priorities and special problematic issues of IDPs. It is worth noting that according to UNHCR, Ukraine belongs to a dozen of the countries globally in terms of the largest number of IDPs. That gives us additional realization as to the scale of the issue we are facing at the moment. We do realize that the issues of IDPs are multifaceted, they vary, and it's difficult to resolve all of them. Negative impacts of internal displacement are sensitive for IDPs. They are equally sensitive for the host communities as well. As of today, both the government and large public face the necessity to resolve a set of different issues that includes the issues of access to housing, social medical services, education, etc. We do realize that in the host communities or in the places of new residence, it's not easy for IDPs to find a job and to find a house. Especially difficult it is especially difficult it is to find the job for women with kids, especially if these are kids of preschool age and they need daycare centers. So these issues are especially acute there. It is exacerbated by the fact that IDPs prior to displacement used to work for mining and heavy machine building companies in Donetsk and Lugansk regions, and it's hard to find the same employment for them in other regions of Ukraine. As we see from the reports, the percentage of the people that have found employment after displacement is lower versus the numbers that characterize the employment rate before displacement. Another serious issue for IDPs is access to housing, in particular because of the fact that the houses of IDPs were damaged as a result of armed aggression of the Russian Federation. The reports are very important for us to have better understanding of the situation as it is in reality, to find comprehensive solutions. The reports are unbiased and impartial. That adds value to them. If you look at the previous reports, we can single out a very positive aspect here. The number of IDPs in Ukraine, the percentage of IDPs in Ukraine that consider themselves to be integrated and reside in the same place for 3 years and more is constantly increasing on an annual basis. And that serves as a positive signal. We see, for example, that in 2018 this percentage was 69, in 2019 it was 80%, and in 2020 you'll see the number in the presentation. So it is increasing anyways. So another thing to note here is that the major reason for the return of IDPs to their original place of residence is privately owned houses. In most of the cases, the IDPs that return to the their place of origin are senior citizens. In our country, there is a number of programs to provide the IDPs with housing. Naturally, they are not sufficient, and one of the programs that the ministry is in charge of directly is subvention to local communities for acquiring temporary housing for IDPs. Starting 2017, when the program was launched, until 2019, temporary housing was provided to more than 800 IDPs. This year, we want to add 260 to that number. We received 20 million hryvnia out of public budget to fund it. In the previous years, the number was different, but it wasn't largely different. For 2021, the public budget targets for 125 million to be allocated for the program. That's a lot more, and thus we hope that this will be supported by the government, by the parliament, and will be able to be one step closer to resolve the housing issues of IDPs. We do understand, though, that even this sum of money wouldn't be able to tackle the issue fully. Thus, we think that maybe international partners, or we hope that international partners will assist us on that. We need to add that for the first time ever in 2020, the government allocated money as a compensation to the victims whose houses have been destroyed as a result of the armed aggression of the Russian Federation. At the moment, we are accumulating all the documents to substantiate the program, and thus we'll be able to start implementing the program. In 2020, we are going to receive 20 million to fund the program. Let me underscore again that the reports are very important. The IOM reports are extremely valuable for us and allow to develop solutions aimed at addressing the most acute issues of IDPs. Thank you. Thank you, Iryna. Before I give the floor to the colleagues that are going to present the key conclusions of the report, let me remind you that IOM conducts regular surveys starting March 2016. Now and again, we change the methodology to meet the requirements of the time, and the colleagues will be more detailed on that. Partly that was caused by COVID-19 and pandemic. We add different issues to cover by the reports. So if the colleagues from international organizations and humanitarian organizations want to know more about that, feel free to contact us and tell us about that. We are ready to expand the scale of the questionnaires and surveys.
We will now present the results of the 16th and 17th rounds. These rounds were supported by the Bureau for Population, Refugees and Migration of the U.S. Department of State. We're ready to answer your questions, should you have any. At the moment, please write to Viber or WhatsApp 067-447-9792 or leave your comments at the broadcast of the Ukrainian Crisis Media Center or the respective rep office of Ukraine. Iryna Loktieva, welcome. Thank you, Varvara. Dear audience, dear Iryna, dear colleagues, let me present the results of the 16th and 17th rounds of the National Monitoring System for the situation with the IDPs. It's a regular study, and we're hosting it since 2016. The purpose of the study is to collect and analyze information on the social and economic situation of IDPs and their households. In this report, we shall focus on the change of the social economic situation for the IDPs in the background of pandemic of COVID-19 and other factors. We will review the characteristics of IDPs and their households. We will review the employment situation, financial situation, needs assessment, and we will also review the situation with IDPs who went back to the non-government controlled territories. Let's look at the methodology of this study. Within 16th and 17th rounds, we polled more than 12,000 participants. Within each round, 2 questionnaires, 2 polls were conducted. One was done at the regional basis with personal interviews. Another study was done by the National Organization of Migration using the phone base of contacts of IDPs. Because of the quarantine measures within 16th round, most of the interviews were hosted by way of personal interviews. The rest was done on the phone. Within the 17th round, all interviews, both within the study conducted on the territorial basis and the study based on the phone books, all of them were conducted by phone. Besides that, every round had 5 focus group discussions with IDPs. And the key informants were the IDPs who came back to the non-government controlled territories. Now let's look at the demographic profile of the IDPs and their households. The studies have shown that the structure of households, that women are the predominant majority of IDP households. 40% of the poll participants have confirmed that their households have children, which was slightly higher than in the general population. Out of all households with children, 1/3 was the households led by women. And 14% of the poll participants have informed that there were people with disabilities in their households. 22% of IDPs were presenting households with people aged from 60 years and older. And then Roman will tell you more about the situation with employment of IDPs. Thank you, Iryna. Dear audience, dear colleagues, Iryna. My colleague Marco has mentioned that the level of employment of IDPs stays at the same level compared with results of prior studies. However, in March this year, we could already observe sharp downturn of the level of satisfaction of IDPs with access to employment opportunities. This may signify that despite the fact that 45% of IDPs remains employed in some way, their situation is still getting worse because of the need to search for a new job or because of the deteriorating work conditions. Marco mentioned that almost 1/4 of IDPs had to take non-paid leaves during the quarantine. Among the general population, according to different assessments, this share was 15 to 17%. We should also note that among IDPs of all age groups, women had to take non-paid leaves more often. The situation with employment of IDPs looks slightly better in age breakdown from 20 to 64. Age 20 to 64. 56% of these people are employed. However, compared to the general national indicator in this age group, 67%, which is 67%, this level of employment of IDPs is still too low to talk about equality of access to jobs between IDPs and members of host communities. The IDP employment problem is also mostly related to IDP women. As of June this year, when we finished data collection for the 17th round, only every second female IDP was employed, while the degree of employment among IDPs among men in this age group met the national criteria. Speaking about the geography of employment, we may note severe reduction of employment in the east and in the city of Kiev. Respectively, this is a 16-17% downturn reduction. The level of employment of IDPs in Zone 4, Kiev, Chernihiv region, Vinnytsia region, and other regions have gone down there dramatically more. The level of employment there went down by 8%. Smaller reduction of employment was in Kharkiv, Zaporizhia, and Dnipropetrovsk regions. In Zone 3. From Sumy in the north to Kherson region in the south, the degree of employment of IDPs went down by 5%, and in Kharkiv, Dnipropetrovsk region, Zaporizhia region, the level of employment has improved. There's a growth of 5%. There's a 2% growth in Luhansk and Donetsk regions. We also have to note that this figure is within statistical error. Unfortunately, this does not allow us to talk about some sort of positive trend against the background of local improvement. Now, about financial needs of IDPs, well, my colleague Iryna will tell you more about that. 17th round. Against the background of certain deterioration of the situation in the labor market, the financial situation of IDPs and their households has somewhat deteriorated as well. Almost half of the poll participants said that they only have enough money to buy food. In the second quarter, this indicator went up by 4% compared with September of 2019. Marco has already mentioned that there are differences in the assessments of poll participants regarding the financial status of their households, depending on their composition. So 70% of poll participants with households of women informed that they only have enough money to buy food. 2/3 of poll participants out of the households that consist only of the elderly people also informed that they only have enough money to buy food. The same share of poll participants who represent households with people with disabilities also mentioned that they only have enough money for food. In June, July 2020, average monthly income per person of IDPs of households was 2,300 hryvnias, which was 350 hryvnias, which was less than in the third quarter of 2019 and lower than the factual subsistence minimum by 624 hryvnias. We also have to note that the number of poll participants who confirmed that they had to spend already limited savings has gone up by 1/3. In the second quarter of 2020. Out of 29% in September 2019 to 40% in June 2020. IDPs have confirmed that they rely on salaries as key source of income. However, we need to note that more than 1/2 of the poll participants have informed that they rely on state-targeted support of IDPs. More than 1/3 of poll participants rely on pensions as key source of income. Iryna has mentioned already that the targeted state assistance is a key source of income. However, as we speak about social payments, unfortunately, we cannot avoid the context of quarantine restrictions. 35% of IDPs informed about the problems with getting social payments during the quarantine. 28% reported that they never left their houses because of the fear of getting infected. 14% could not use public transport to get to the place of receiving social assistance. I'm mostly talking about the elderly people here who understood very well the possible consequences for their health because of infection with COVID-19. Against the deteriorating financial situation of IDPs, the problem of housing remains very relevant. And the first thing we need to note is that unfortunately 60% or the vast majority of IDPs still live in rented houses. 89% of IDPs say that the existence of their own housing is the key factor of integration, and respectively, lack thereof is the main obstacle against the sense of belonging to their host communities. Most people say that 38% say that lack of their own housing is their key problem. A lack of documents that could sort of attach their contract to housing, that would secure their contract, lease contract would be a key problem. Almost 1/2 said that they risked losing their rent. They rented housing because of their inability to pay rent. It was 27%. Almost one half had to change their housing because of high rent. So we have reviewed the key issues related to social and economic situation of IDPs. It's very important to make sure that the problems and issues that IDPs have could be articulated and sort of the structures and organizations who take care of these problems could know about this. At the moment, it's very important to develop respective communication tools that could inform about the key problems and needs of this population group. Taking into account all of this, our latest poll, following the consent of the ministry, included the question on the problems and needs of the poll participants that they would like to inform the government about, should they, well, if they had had this chance. Now let's look at their answers. The study has shown that the first and foremost issue is the issue related to housing and financial assistance. Besides that, poll participants would like to inform the government about their needs in the medical and social support. It's very important that the share of people who noted humanitarian assistance is an important component and something that they would like to inform the government about has grown by 5% from February to March 2020. Poll participants have also noted that they differed in their preferences about the problems and issues that they would like to inform the government about. Households with children led by women. Informed more and more often that they would like to inform the government about their problems with housing.
About the need for monetary assistance and medical care. Those households that have people age 60 plus most often said that they would report about need for medical care and medications. There were twice as many of those versus the average indicator. Households that have people with disabilities more often said that they would communicate to the government about the need for healthcare and similar needs. So there were 28% of them. Despite, as it was said before by the colleagues, despite the fact that representatives polled face various diverse issues linked to the access to labor market and the need in permanent income as well as access to housing. Our survey showed that most of the IDPs continue living in the host communities. And as it was said by Marco, the number of respondents that would like to go back to the original place of residence decreased from 28% in December 2018 to 19% in June 2020. Then the next about IDPs that did return. We also interviewed the IDPs that for different reasons decided to return to non-government controlled area, maybe for some time, maybe to stay there permanently. When asking them by the phone, and it was conducted April, June this year, out of 3,700 IDPs, more than 20% were identified as those that returned to non-government controlled area. It's not statistically representative number, but it allows to say and speak about the reasons of return and the mechanisms for making this decision. Property ownership was the major reason for 86% of IDPs able to work to return to non-government control territory, and for 94% of older people. Respondents aged 18-64 most often stated family reasons versus the older people. That's 38 and 26% respectively. Generally speaking, property ownership as the main cause for return matches the major reason that IDPs state when polled. That's lack of their own or accessible housing. Most of the IDPs, 96% of returnees to non-government controlled territory, live in their own houses. Let me quote some of the opinions that we received in focus groups. That was a female from Lugansk, aged 50, who said the following: the money I make, I don't match expenditures. Due to quarantine, I couldn't pay my rent and had to return to non-government controlled territory since I spend most of the money that I make. So the availability of housing owned by IDPs is really dominating. If you look at the breakdown of those who have returned, so these are mainly people of older age and households with one or two persons. So the conclusion that you can make is as following: the older the person is and the less relatives the person has, the most likely they are returned to non-government controlled area just due to the lack of means to support their livelihood on the government controlled territory. Speaking about the major issues faced by IDPs upon return to non-government controlled territory, that's mainly safety issues with access to medication and healthcare, and utility payments. Again, a quotation from one of the interviewees in the focus group. My grandmother faced the situation when the doctor prescribed the medicine that you can't buy here. He said that you can buy it or order from the government-controlled territory, or you need to go there. He prescribed the medicine that is needed, but it's impossible to buy it in my hometown. That was said by an IDP female who returned to non-government controlled area in Luhansk Oblast. And it is a non-government controlled area in Lugansk Oblast, as survey points out. The issue most referred to was access to medicines. As to the plans for the future among the returnees to non-government controlled area, as you see, most of them are going to stay there, and that kind of re-echoes the plans of those who stay on the government-controlled territory. If the persons are staying somewhere, residing somewhere, it's much more difficult for them to make the decision to leave the place and go elsewhere. That was most important part and data from our presentation. To recap, we enjoyed or used the results of the survey that we have been conducting for many years, and we very much hope that we'll continue doing these surveys to provide the relevant information to the ministry and our partners on humanitarian programs. As we said, the major conditions for IDP reintegration remains housing, employment, and personal income. The research, I'm not going to repeat all the conclusions, but generally speaking, the survey proved vulnerability of IDPs on the above mentioned issues, that's employment, housing, and income, and addressing these issues was complicated given pandemic. That underscores a critical need in identifying long-term solutions to integrate IDPs in the host communities. Thank you for your attention. Thank you, Roman and Iryna. Are there any questions on any of the resources available to raise questions? That's the question to Ukrainian Crisis Media Center colleagues. No questions at the moment. Then, oh, okay, we don't have any questions either. Well, it was a really fundamental, comprehensive research made. Lots of information, both of the reports for round 16 and 17 are available on the website of IOM in Ukraine, in English and in Ukrainian. You can access them, and we remain open to answer the questions. If you have any, we'll be ready to answer them after the presentation. The question to the speakers, do you want to say something as closing remarks, please, Iryna? Let me thank you for the fundamental report. We are going to use it, and we have been using it now. Another valuable thing for us, as it was already pointed out, is flexibility of the interviews and surveys, and we can add this survey with other questions depending on the development of the situation to get a better picture, as it happened with COVID-19 pandemic, and this report shows how COVID-19 pandemic had an impact on IDPs. Additionally, the survey is gender sensitive. That's another important thing, and it has a breakdown based on age. So depending on the situation, we'll stay flexible to complement the survey with additional questions. Thank you. Thank you, Iryna. I think colleagues agree that we are looking forward to your reports and new proposals. Thank you very much indeed. See you soon. Stay safe.